Hey everyone, welcome back to Med-Surg Knowledge Nuggets, where we take big nursing topics and break them down into manageable, test-friendly content. Today we're talking about blood loss anemia. Let's start with a quick refresher on anemia in general. So anemia basically means there's a decrease in red blood cells or hemoglobin in the body, and there are three main causes of anemia. So the first one is blood loss. So you're actually losing blood from your body. Second is insufficient red blood cell production. So your body just isn't making enough red blood cells. And the third is excess destruction of red blood cells. So your body is losing these red blood cells, they're being destroyed, and your body just can't keep up with production to replace these red blood cells that are being destroyed. So another thing to note is that it doesn't matter what type of anemia you have, it will always result in decreased oxygenation to your cells, tissues, and organs. You can have mild all the way up to severe. And also one thing to note is that any type of anemia you have, because it's directly tied to oxygen, you're going to have overlapping symptoms of all types of anemia. And these general signs and symptoms include fatigue, weakness, pale skin, irregular heartbeat, shortness of breath, dizziness, chest pain, cold hands and feet, and headaches. All of these symptoms are directly tied to the lack of oxygen to our cells, tissues, and organs. So for example, fatigue. Fatigue is a subjective complaint, concern that the patient will express, and you should be thinking, you could be anemic. So yes, fatigue could be some other symptom to some other condition, could be related to, breathing, the lungs, the heart circulation, but it could also be related to, a lack of red blood cells or hemoglobin. So we need to rule out those other things. Fatigue is also a great indicator to see if the patient is doing better, like our interventions are doing better. So if a patient comes into the doctor's office and says, I have fatigue, and we find out it's a type of anemia, then when we see them again, we want them to say, I have less fatigue, I have more energy. That means things are returning back to baseline. All right, so let's get into it. Blood loss anemia. We have acute and chronic, and let's define both. So acute blood loss, this is going to happen abruptly, it's sudden, it is active hemorrhage. So this could happen from a trauma, maybe a big accident that happened. This could be due to complication of surgery. So maybe the surgeon accidentally nicked a vessel, an artery, and then you start to bleed out, lose blood. Or it can be from a disease or condition that disrupts total blood volume. And an example of this would be a brain aneurysm, something that ruptures in the brain, and then you have this hemorrhage. So one thing to remember is that if you lose a lot of blood very quickly, clinical signs and symptoms are more important than laboratory values. And what that means is if you draw someone's blood right away when a trauma happens as they're bleeding, those values are not going to reflect the fluid status accurately because the body kind of needs to normalize. And I'm going to give you an extreme example so that you can remember this. So if you had your arm removed and torn off in some traumatic event and you're bleeding out, and then I draw your blood at the same time on the other arm, those blood values are not going to reflect what's happening. Your body doesn't know. It needs time to kind of like realize in those levels to kind of get to be accurate. So clinical signs and symptoms that we're going to go to, we're going to ask the patient if we're able to, we're going to get our vital signs. Our vital signs are a great assessment and indicator of our fluid status. So if you're losing blood, you are going to be tachycardic and you're going to be hypovolemic. So tachycardic, your heart rate gets faster as it compensates for the lack of oxygen circulating. You are going to be hypotensive. You're going to have a low blood pressure because of the low volume. So those are two vital signs that you should always remember and always tie them to possible hemorrhage. Okay, so moving on to clinical manifestations, signs and symptoms. Patient's going to have pain. Internal hemorrhage. If the patient is bleeding inside somewhere, we might see tissue distension, organ displacement, and nerve compression. So tissue distension, this is where you see in the movies and on TV shows where the patient comes into the trauma room and the emergency room and their abdomen is distended. So we are thinking there's blood. We can do an ultrasound and see fluid, and we're going to assume that fluid is blood. Organ displacement. So as the belly fills up with blood, it's going to push whatever structures are in there to the side. So if we look, for example, on a CT scan and we see kind of things, moved over to the side, that is organ displacement. We are going to suspect there's some type of bleeding going on in there. And then we have nerve compression. So the weight of that extra fluid filling up in the blood really pushes on everything, so including vessels and nerves. So the patient might say tingling, they may have those neuro changes, neuro deficits, and they may say they may feel numb. Then we have retroperitoneal bleeding. So your peritoneum is, we're going to say your abdominal cavity. So a patient might say they have numbness or pain in the lower extremities if they have active retroperitoneal bleeding. So here's a clinical example with this in play. So you're the nurse and you're taking care of a patient who is post-op, we'll say post-op day 2. So the patient had a big abdominal surgery, and at the start of your shift, the patient was good, vital signs normal. We have the expected amount of pain, we'll say 3 out of 10. But then midway during your shift, the patient is now complaining of numbness and pain in their lower extremities. So first thing you're going to do is suspect that they might have a retroperitoneal bleed. You're going to take a peek at that dressing to see if there's any blood coming out. Whether there is or isn't, you're going to take your vital signs, you're going to assess the patient so that when you call the provider, you have information to tell them. So you got to think quick, you do your assessment, vital signs, and you call the provider. So diagnostics, again, with sudden blood loss, those lab values may seem normal for a couple days, so we are going to depend on our other assessments. Once the body normalizes and plasma volume is replaced, then low red blood cell concentrations could be seen on your lab work. So low RBC, hemoglobin, and hematocrit levels will reflect actual blood loss, and that's the labs that you're looking at. So the treatment, very simple. You're going to stop whatever's causing the blood to be lost, and you're going to replace it. So we're going to give fluids, we're going to give blood, whatever the patient needs. And these patients will need supplemental iron. So we don't give iron to every patient that is anemic. It really just depends, because remember, our body recycles iron. And if you have too much iron, it can become poisonous to us and actually kill us. So we don't want to just give iron just to give it. But if we are losing whole blood out of our body, that means we're losing all that iron that are in those red blood cells. So this would be an appropriate time to give supplemental iron. Okay, so that is acute blood loss anemia. Let's take a look at chronic. So chronic is slower, right? It's not acute, it's not abrupt. This has been happening for a while. Examples would include a bleeding ulcer, like in your stomach. Could be cancerous, like a tumor. Hemorrhoids. Hemorrhoids bleed little at a time, sometimes bleeds at more times than others. Heavy menstruation. Females who have heavy periods can experience blood loss anemia that kind of fluctuates throughout the month. So your signs and symptoms, they're going to be those general signs and symptoms that we talked about, the fatigue, maybe headaches, all of those things that we talked about on the previous slide. So the treatment, pretty simple. Identify the source, stop that bleeding, and you will also provide supplemental iron as needed, because again, we're losing blood. Our final nugget for blood loss anemia. So when it comes to blood loss anemia, think about the timeline. Did it just happen? Is it abrupt? That is acute. The patients might need rapid volume replacement and close monitoring so that they don't go into hypovolemic shock. Chronic means slow, sneaky. Patients might just seem a little bit off until you ask questions and they tell you some history, we run some tests, and then we discover, you've got some bleeding going on somewhere. So as nurses, our ability to recognize those subtle cues, ask those right questions, and act quickly can make a huge difference in our patient outcomes. So thanks for watching. I hope this clarified things for you. Be sure to like, comment, and subscribe for more Med-Surg knowledge nuggets just like this one. See you in the next video.